Certainly, I can detail the process. The journey typically starts with an initial consultation and planning, where a dental professional assesses your suitability. The next stage is the implant placement through a surgical procedure. Following this, there's a crucial period called osseointegration, which typically takes a few months to allow the implant to fuse with the bone. After healing, an abutment is attached, and finally, the custom-made crown is placed to restore your smile. Does that cover what you were looking for?
Okay, that's fair enough. So, is it a safe procedure? Are there any risks, or is it too early to talk about this and you would rather talk about the benefits first? Why do people get implants in the first place, and what kind of cases are even indicated for teeth dental implants?
Dental implant surgery is generally considered safe, with high success rates. People typically choose them for various reasons, including replacing missing teeth for function and aesthetics, improving chewing and speech, and preserving jawbone health. Indications can range from single tooth replacement to full mouth restorations. Just a